Okay, and now we'll ask Francis Stout to give our welcoming remarks.
If you don't mind, I hope you don't mind, I'm going to leave my dark glasses on. I forgot my regular glasses, and I don't see too well. The glasses, as you can tell, I spilled cereal all over myself. I thought I'd better tell you quick so you'll know what happened. We had breakfast in another room, and I'm so pleased to see all of you here. And I'm glad you took the time to come here, because I know it does take time, it does take interest, it does take passion. I was listening to someone reporting from Puerto Rico the other day, and I think it was the governor or one of the units there, or the mayor, I think it was the mayor. And he said that he wasn't concerned with the passion of being a FEMA or anybody else. It's what I'm concerned with. What I work by is the mission in my heart. And it made me stop and think, what was the mission of my faith that's in my heart? Why have I been here 17 years? And I think of the rest of the board members, we've all been here a long time. And I'm sure it's the passion we have, the mission is in our hearts. And so, but it wears our brain out, things going, as each of you know. You sit down and, like you're going to do today, and think about U.N.I.T.E. I just love that name, title. And it's so important, I think. I was reading an article, and the article was on what this person called wicked problem. And I thought, we have a wicked problem. I don't know whether to tell you or not, but I feel it's big. And he said that usually there's very few solutions to the problem, and that it's hard to define the wicked problem, but it's there. But he said there's three things that I suggest. The first one is communicate. And the second one is communicate. And the third one is communicate. I think that's so important for this group. You sit and communicate with each other, and that you go back and communicate with your coworkers and with your community, the leaders of the nation. I know that's hard. It's been hard for us to really get things going with our community, and because the community sees the nursing home in one way, and they let us know, you should be doing this, you're doing this wrong, and this is happening to my father or my uncle, and so forth. So we have that all the time. That's the wicked problem. How do you, what are the solutions? Like he said, the three solutions. I'm going to remember that. Communicate. And the other thing is that when you are communicating documents, he said, write down things that they say and things that they want. He said that's so important. It's kind of, all of a sudden he said, those things that they're saying, he said, I know what we make that better. So I like the term unite, or the title unite. It does bring us together here. I'm thankful that you're safely here, and that your new home will be safe. And I hope together we can move forward with really doing person-centered care. And I know it's very difficult for us as leaders to get this across to the staff. And if you have a special way that you do it, let us know. Sometimes we have an issue. People don't want to change. That, we did it this way. And I'm sure you're familiar with that. But I think person-centered care really important. And we get caught up in, or our staff gets caught up in the routine, and they lose the person in that routine. So we just have to, if you want to take a look at the procession is going, is moving. Everybody takes part.
You know what, Sheila, open up. Let me open up. Thank you. Just go on one of them. One of them will go out. There you go. We'll take a minute to look at that.
We're watching our St. Francis Day presentation right outside the window here for a minute.
Hey, Francis. contain. And everything has to you can see some of our staff out there pushing the field. Our next students, there are other church staff, Presbyterian, no clears Adventist. Read. Okay. I have a list of all the activities this day, so when we break, I'll get you all a copy of that. But it pretty much goes, so, that the main part where they'll be dancing and stuff will be free to participate in all of that before we come back to that last session. So you will definitely have time around those to take pictures and talk to people and get food with them. I think we do allow pictures. I've taken pictures, but I usually ask if I can, I ask if it's okay. And I don't usually post that on Facebook. No. Is there anything? Okay. Is there anything? No, I think. Thank you very much. And I'd like to again thank the council board for sponsoring our breakfast and our lunch today. And for the driver provider, was that good for those of you who took the van? That worked well? Okay. Probably go with me just in case. You wanted to be able to open the windows. Probably went with me. So great. Let's follow our agenda. Could I say something before we do it? Absolutely.
I think that we all need to recognize Debbie because she works tirelessly for all year long. And without her being your glue to hold us together, I don't know that we would succeed. And so I think that we really need to give her a round of applause for her dedication to your work.
And I appreciate that. And I do work hard, but I have to say something, too. If the board didn't allow me to do this as part of my job, it wouldn't be happening. So I have a fair amount of flexibility with what I do, which has made this possible, to be honest. So, but sometimes I stay up really late. And I do some work on weekends, so that helps too. So let's follow our agenda. I think you all have it in front of you so we don't get too off track here. Let me go to my drive here a minute and just pull that up, because I think we had updated that. I want to make sure I'm working off of the right one. And I don't want anyone to feel rushed, but I do want you to remember that, we'd like to get this done here in less than an hour. So I don't, if one person talks for 15 minutes other than Ron, who has permission, it may go kind of long. So you just kind of think about, when you're saying something, not going too long. And I'll try to do the same, which, I'm working on it. And just keeps telling me I can't volunteer for everything. I'm like, really? Oh, well, I thought I did. All right. So let me get to it. Hold on a second. There it is. Okay, good. So we did the welcome and the blessing. This is the updated meeting agenda that was sent out with the invite for today's call. So if you have your email, you can check it out. So Melissa, we're ready for the honoring of Kay Brandt.
So thank you, everyone, for making it down to Tucson. And I apologize for not making it there. We have our statewide Elders and Youth Conference that was at the beginning of this week, and now we are in the statewide Alaska Federation of Natives conference, which will conclude tomorrow afternoon. But, I was really thinking about how in the world to share with the group how this collaborative got started, and in a way to honor Kay. Even though she's not here with us, she is still with us in many capacities. So I remember hearing Kay on these phone calls, and I'm doing the work that was assigned by her, and she'd be calling, folks, outside of Alaska, just coordinating things, and I kind of wondered what is Kay working on? So Kay always had a passion for keeping our tribal elders in their respective communities, finding ways to keep whatever services we have going for our tribal elders, and if there are areas of improvement, finding ways to get those improvements to keep our Native elders at home. She was known as a go-to resource for helping families in not only in Alaska, but on a national level. So if she didn't know the answer, she would actually find it for someone and share it with everyone. In working on this collaborative, in our brochure, it talks about what we do as a collaborative in finding the best practices and building our relationships with one another. We network, we provide educational opportunities, and we want the quality service that our tribal elders deserve, and a way to respect, our elders in, like I said before, keeping them in their communities. So, a lot of the things that we continue doing moving forward is we are honoring Kay and keeping her spirit alive in the different capacities within our busy work schedules, I guess you can say. So it was a real honor to be asked to help work on this brochure. And, on the back center of it, in honoring Kay Branch, it was funny every time she was on the phone call. I'm not sure what the other end of the recipient on the phone call, what they didn't understand about the word branch, because it's to me, it's the easy English word. How they couldn't understand, and so she would always say Kay Branch like a tree. And so just creating this brochure, the backside of it, like a branch on a tree, we unite to serve our tribal elders, but our roots keep us all together. And that is exactly what Kay thought, that it doesn't just take one root to make things happen, for the tree to grow and continue growing. It takes multiple roots to keep the tree healthy, and supportive and strong for its intended use. So thank you, Debbie, for allowing me to give this honoring of Kay and continuing to be on this collaborative, serving the Alaska Native population and working with our 6 tribal long-term care settings to keep them informed on what this collaborative is doing as in regards to incorporating our traditional Native foods in our long-term care settings is a very important aspect of respecting and serving our elders. Because at the end of the day, we go home and we make our home-cooked meals that make us feel good, remind us of, different things that have occurred in life. And that's what our elders love, especially the spiritual connection to our traditional Native foods. It's not just, something that you just go and buy in the store. It's an actual connection. It feeds our soul and it feeds us, physically. So thank you again. And I hope to be there next year, as long as it's not during the same week as this statewide conference.
Okay. Thank you, Melissa. I appreciate that and all you've done for this collaborative over the last year. Let's take a look here. We'll have a quick roll call and introductions, but some of us were introduced last night at the dinner, so if we can just kind of move through this quickly. We have Melissa Heflin on the call from Anchorage. Julie Cahoon, Tony Curtis, and Jonathan Collins are on the call from KAI. Is there anyone else on the call at this point? Okay, good. So, Francis, you want to just start?
Francis out, and I'm a member of this nation's chair of our
Tammy Reed, Fort Washington, Wyoming, Morningstar Care Center Administrator. Currently crossing with the Morningstar Care Center, Fort Washington.
Teacher here, the Health Advisory Group. I hope you're glad to be here.
I'm Ruth Tracy, coordinator and joining the teacher.
Ron, president of Native American.
People Wiggins, the nursing home administrator for Laguna Elderly Care Center on the Pueblo of Laguna. I'm Joseph Sarah, I'm the director of the New board members.
Okay, thank you. And Debbie Ditek, Education Coordinator here at R200. So if anyone joins during this time, please state, we'll interrupt, and you can let us know that you're here. I think what I should do quickly, Francis, if you don't mind, is just pass around an attendance sheet. If you don't, just sign in so I don't forget at the end of the day who all this is. Although we will be taking a picture, so that'll help. Okay, so I'm going to give a quick review of 2017, and then we're going to talk briefly about the membership. So like Melissa said, I think we've had a good summary so far of what we're all about. We all have the brochure. We do a monthly call. We've been very consistent about that. So we've been very consistent. Our monthly call has been the third Thursday of every month. We've done it from 12 to 1 Arizona time. The only change that's happening moving forward, Tony, that's starting, I think, this month, right, where it says Eastern Standard Time?
November, yes. When we change over, we're going to go off of an Eastern Standard Time.
Yeah. So but the invite will always say Eastern Standard Time.
Right, but it'll also include a timetable for everybody's ease. so they can see it within their time zone.
Okay, so when you get your invite, and we decided Kaufman Associates is now handling the call invite, okay, and they can talk a little bit more about that. But it'll be much easier. There'll be one set number. It'll tell you this is in your time zone. This is what you do. So, sorry.
Hey, Debbie.
So it's been very. I'm sorry. Go ahead.
Sorry, I just want to say thank you to Kaufman and Associates for doing that, because being up here in Alaska and trying to figure out everybody's time is sometimes confusing.
Yeah, I agree. And we realized that was a problem, along with some of the way the documents were being sent out. So we're trying to make adjustments. So we can decide as a collaborative if we want to change that. Right now it seems to be working, but we're not stuck with the third Thursday of every month. So if somebody wants to change that today, we can certainly change that moving forward into the coming year. We do have a steering committee. I've asked in your evaluation if you could please raise your hand and say, I'd like to be on the steering committee. To be honest, there's only about 3, 4, 5 of us right now that are on it every month, and we'd like to get a few more people. There's some people assigned to the steering committee right now who aren't attending for just different reasons. But so if you're here today and that's something, it's just once a month. We go with the second Monday of the month. If you can do that, please put that information on your evaluation when you hand that back in today, and we will add you to the steering committee invite. So that's a separate invite. So that number, that calling number and password, that's a separate invite from the monthly call. Okay? We try to have a speaker on our monthly call. We don't always, but we have a set agenda. So we ask for the ombudsman report. We ask for the QIO report. We ask for the administrator's report. We ask for the director of nursing report. So we try to give everyone a voice on the call. So, and some calls, to be honest, this past year, I think there was one month where it was just Lisa and I on the call. But we did it. It's like, okay, Lisa, let's just talk anyway. But, I mean, obviously we want to get everybody. We want to get the whole collaborative and everyone calling in to really get that feedback. So I think we've had a pretty good year. Like I said, we did have a steering call and a monthly call every month this year. We hosted 2 of the long-term support service CMS webinars, one in May, one in July. Those are scheduled for us to do again in 2018. I serve, and there's Joseph Ray, call in for the TTAG call, so the Tribal Technical Advisory Group that's part of the CMS. So John Johns from CMS has invited us on that call, and in fact, U.N.I.T.E is on their agenda every single month. So when I call into that call, I'm actually on the agenda because they want to know what are you guys doing? What are tribal nursing homes doing? So that's been a really good thing that started a couple of years ago, and we do take that call. Other than that, I think, some of the challenges we can talk about later. But let's look at the next agenda item, which is the membership. So if I can refer you all for a minute to your folder. Melissa, I will have to mail out folders to people who weren't able to come today because I'd like them to have this. So we took the list of members off of the cms.gov website. So it's right after the PowerPoint. There's not a page number, but it's in the very last section, kind of probably in the last 5 or 6 or 7 pages. Looks like this, okay? So if you can go to that page in your folder. And we'll just look through our membership real quick because I know there's been some changes. So Maniluk Association, that's in Kotzebue, so Val Crail. And Melissa, Helen's not there anymore. It's someone else, right?
Yeah, I'm not sure what's going on with Kotzebue at this time. I know that Val will be on limited phone conversations. I just don't know the extent of his participation.
Right. Val's had some health problems, and I've talked to him several times. But do you know Helen's not still there as the DON, correct?
Yeah, I'm not sure on that part. I can find out for you and send you an email.
Yeah. You might want to just mark this up and put a question mark there. Marianne Bornichello is at NOME. Does she function also as the administrator, Melissa? Do you know?
I believe the administrator. You mean for the facility?
Yeah, for the Norton Sound. Well, yeah, for the care center.
Angela Gorn is actually the administrator.
Yeah, okay, I still have her. Okay, Angela Gorn is the administrator. Marianne was going to come but was unable to at the last minute. She is on some of our calls, though. And then, of course, Gerald Hodges and Elizabeth Leslie are still at UConn. I'm not sure why Gerald's name's not on here, but it's Gerald Hodges, Hodges, and he was at the meeting last year. Blackfeet Nation, Martha Spotted Eagle. Does anyone have any contact with this facility at all in Montana? You do?
I called her like 4 times.
Okay.
I was actually at the conference we went to in Minneapolis.
Okay. Because I've tried reaching out to her and have not heard, so we'll see. But as far as you know, she's still there as the administrator. All right, and then if you flip over, you can see this is divided into regions. We have Sally Hutton up at the Nespel in Washington at the Colville Tribe. I did talk to her. Her email was out. She said, I'm sorry, I haven't had email for like 2 months. She gave me her fax number. I faxed her a bunch of information, and then I never heard back. So I'm not quite sure what's going on, but I know Sally Hutton was there. She was very interested in this collaborative. Morning Star, of course, we have Tammy and Carly here. Thank you very much. Gila River Caring House is no longer Dean Kidder. We have Stephanie Belton. I think it's Belton. Okay, so she is the new administrator. Does anyone know who the DON is at Caring House? So the Caring House, when I drive back to Phoenix, I literally pass that nursing home on my way back to Phoenix, okay? Chinley is here, except for Wayne. We're missing Wayne, but we have Ruth Tracy, so that's great. And Ruth, can you tell us how things are going with your Native Veterans nursing home?
I'm not exactly
Very good. Okay. And Chinley is how many miles? It's almost to the border. It's in the Four Corners area, right? From Tucson to Chinley. Yeah. It's in Arizona, but it's like Arizona. And then, of course, Archie Hendricks, which is Francis and myself and Juana. Pueblo of Laguna, yes, here. Awesome. Wonderful. It's obviously not Sandra Casper anymore. So you can now put Sheila Wiggins, who's sitting here with you today.
Hey, Debbie, it's Melissa Heflin.
Yes.
I've got to get back to work here at the AFN work table that I'm at. So
would you like to
send me any notes? And thank you all for participating and being there in person and networking, and keep up the good work in your respective communities. And I look forward to talking to you next month.
Thank you. Melissa, did you want to just say a word on the traditional foods, because you were on the agenda for that later? Did you want to just pop in a few words on that?
So we are still working with our seal oil task force in having seal oil in our long-term care settings, and Manilik has actually worked with an organization to mimic the traditional process, and we still continue to serve traditional Native foods at our medical center through the what is it called? Through the catering service at the hospital, and we still do our traditional Native food luncheons at one of the nursing homes here in Anchorage. There's some movement going on in Bethel with their traditional Native foods. They're working on actually adding more staff and having it more available to the elders that reside at their facility. And Nome still continues to provide traditional Native foods. They actually have a cultural coordinator there that cooks different native foods for the elders at their facility, and any other efforts that are going on for Alaska, I'll make sure to keep everyone updated.
Excellent. Thank you very much. Appreciate that. And we have forwarded certain links and different things that are going on across the country. So thank you very much, Melissa. Going back to thank you, Midwestern region, Comanche Nation. Does anyone know anything about Lawton, Oklahoma? The Edith Gordon Assisted Living Center? Anyone know anything about that? Okay. I'm not sure. I have not been in touch with Melanie Lewis. Red Lake, I've tried reaching out several times to U.N.I.T.E Walker. I think that is still the correct administrator, but have not been in touch. Shannon Sassoni is new. Carl T. Curtis, if you remember, a couple of years ago, there was a different administrator that came to our meeting, and she is now not there, but Shannon's there. And I did talk to Shannon at one point, but she's not usually on the call. Do you know her, Ron?
I'm familiar with the Omaha side.
Okay. All right. And then, of course, Agala Sue, Susan Poirier, and Ron obviously knows. Susan.
And the director of nursery, her name is
Pam. D-O-N at OS. Okay. Yep. Okay. Perfect. What's Pam's last name? Okay. Okay. But that's your D-O-N. Okay, very good. So, and they were unable to come, but Ron came, which is great. Rosebud Sue, same thing. It's not Janet. It's
his name is Brandy, B-R-A-N-D-I. Last name is Grant. He's the administrator. I'll have to give her
email.
And then the director of nurses, her name is Whitney Ryan.
Okay. If you can get me their emails, that'd be great. So we've got Whitney Ryan and Brandy Moran at White River Healthcare Center. That's in White River, South Dakota. Excellent. We're pleased. Oneida Nation, Anna Johns, David Larson. I did reach out to him. I didn't hear back from him in Wisconsin. Mississippi, Wendy Moran, I also reached out to her. A couple of years ago, she talked to me on the phone. We had a long talk on the phone, and she was very interested in U.N.I.T.E. And she actually was going to come, but I have never heard back from her. So I will try to continue reaching out to her. I did leave her a message about a month ago about this meeting. And then we have David Hunt, of course, at Tasali Care Center in Cherokee, North Carolina, and that's where Dr. Blythe Winchester is. Some of you might have heard her speak. So we do have an assisted living facility, obviously, right across the way here. That's our assisted living facility. I know that Rendella Bluehouse from NICOA said that her mom has one up on is it the Navajo Nation? Can you spell it? Yeah, Ganado. That's what she said. Okay, I'll have to get that information from you. And where are the other assisted living? There's 4 in Alaska, and we got those nailed down on our last call. We've got 4 assisted living facilities in Alaska, Ganado, here. You guys have them? Oh, there is. Okay. Okay, with you guys. Okay. We'll have to follow up and get the context and all this. ABEDA? Would you? Okay. Okay, so she's the administrator for that, or the owner. Yeah. Is there a tribal assisted living? Okay. Okay. Okay, so we'd like to include them in our talk. Okay, so that's good on membership. Anyone have any other tribal nursing homes or assisted living homes they're aware of that need to be on this list or updated? Okay, good. That'll help. All right, so we're going to continue on through our agenda. Yes. So this gets updated. I basically do a lot of the legwork, and then I contact Tony Curtis with KAI, and he will make those changes on the CMS document. Yeah, so KAI is the arm for to make sure that everything's current on the website. Okay, so we don't have an official GWEP report other than I serve on the Geriatric Workforce Enhancement Program, which is the Center on Aging. The Dr. Jordan Lewis, who's part of our collaborative up in Alaska in Anchorage, is also part of their GWEP up there. So the GWEPs used to be called the Geriatric Education Centers or the GECs. Now they're the GWEPs. The grant ends next year, in June 30th of 2018. They're hoping to get funded, obviously. So we'll go to their website and just take a look at a couple things. But I serve through the University of Arizona GWEP. I do some of the geriatric work here that they get credit for, basically, on that grant. So that's kind of the connection and why they sponsored our dinner and did the brochures for us. Ombudsman report. I don't think Teresa Holt from Alaska was able to call in, but she is the Alaska Ombudsman, and she does call in to some of our calls. So I'm going to let Elizabeth Jose speak briefly.
So the other one, other hat is being the ombudsman under Internet type of Council of Arizona. And what I do is I advocate for residents of facilities, living homes, and there's a picture here that we found, and we could. Right now, I'm new. I just started, and so I over right here in this area, learning and content. Just keep your hand on it. So I contact. But this brochure has all the food service, but mainly I'm here and around and but we can't go for our facilities. So these are the brochures that we use, and it's free and confidential service. And our goal is to protect and advocate and promote the rights of residents in long-term care facilities. And there's another lady that works with me, but right now she's interim manager for our senior service. Our manager's not there, so she might be able to help. And we have, I also work with two ombudsmen from Koyaki. They have two ombudsmen. I think there's one in Apache. I haven't met her, but that's what we do. I just go and I visit the centers, nursing facilities, and visit with our native members. And as we were talking last night, it was stated that our elders they don't understand or speak English, and a lot of times I go in there and I talk to them in my language and ask them, how are you being treated, how do you feel about the facilities, and just kind of have a conversation with them or just visiting. I try to do a 1 month visit here at our G100 nursing facility and assisted living. And we did attend a resident council meeting to inform them that, that we are here available for them if they have any questions or if they need to see us. And I haven't set up one for the living, just to call me and give me a date. Talk to the residents about the service that's available to them. I think that's all I have. I usually give one out. It's still a nursing home residents feel upright, and you should give it to the elders for their families when they come visit, or if they can read. You should go over and ask them questions about what they do. Also visit different nursing facilities and in Tucson. I do a monthly visit to our members that we do have.
All right, thank you, Elizabeth. I really appreciate that. Make sure. Is Teresa Holt on the call by any chance? For the calling number. So we're going to move on and is Lisa Johnson on the call? Okay, so I'm going to let Keith Tardier take the phone about the QIO report. I'm going to have that. Keith, look at get that down to him so they can.
All right. So who is familiar with the QIO program? Okay. I'm going to send Debbie you a bunch of links that you can send to the group. I figured that'd be easier because there's so much information out there. Sometimes it can be overload. But the first link I want to make sure everybody has is QIOprogram.org. And the reason I send that is because I'm the QIO representative for the Nursing Home Collaborative here in Arizona. And so the work we do here is essentially the same work every other state does. So we had to recruit 75% of the state's nursing homes, work with them on antipsychotic medication reduction, quality measure improvement, and implementing QAPI. So if you go to QIOprogram.org, you should be able to find your state's QIO and the contact. And I know with the regulations, that November 28th deadline coming up, there's a lot of stuff coming down the pike. And I would really advise you to get in contact with your QIO representatives, see what kind of resources they have to help you out. Because part of the strength of our program is we meet on a national level, so we get a lot of resources from CMS, CDC. We can help distribute those. The other thing I just want to go over briefly is I know November 28th is coming up. And so we were talking with Laguna last night, too, about some of the challenges that are coming up with that. So I just want to make sure everybody's aware of what those regulations are going to entail. One of those is the facility assessment. So this is essentially an organizational assessment. It's a large document that basically allows you to define all the services, your patient and resident types, your diagnosis that you commonly cover, some of the cultural considerations that you have in your facility. So it's a really powerful document that can help really define your entire service structure in your nursing home. And it's one of those documents that should be living throughout the entire year and should be updated constantly. We have a template that we got from our national program, and that's one of the links I'll send over to Debbie. And so by no means is this template or any template we send out going to ensure regulatory compliance. So that's got to be my disclaimer on it. But it was reviewed by CMS, and so I'm pretty sure that this facility assessment, it has the regulations in it, so everything matches back and forth with the regulations to this assessment. And anything that is regulatory, I know it feels like a burden because it's mandated, but I do implore you, think about these things and how they can really be used in your facility. They are things that they want everybody to do, the kind of language that they're trying to teach everybody to use, but these things are actually very useful. And so do your best to try to see the value in a lot of these practices. The other big plan that's due on November 28th is the QAPI plan. Keep in mind that just the plan is due on the 28th, and then you have 2 years to essentially implement QAPI. So we also have a template that I'll send to Debbie that can help you guide through that QAPI plan development. But don't waste these 2 years. I know I talked to Debbie last night, and this is across the board with all the homes we work with. QAPI requires a lot of teamwork, requires a lot of insight from people who may not normally be part of quality improvement. And kind of to your point with person-centered care, it's really the way to drive person-centered care because those CNAs, those housekeepers, people working in facilities, they see their residents in a much different way than leadership often does. And they have eyes and ears and experiences with those residents that leadership often doesn't have. And QAPI can open up that communication to allow that insight to get to the leadership level and really drive that person-centered care. So again, it's a really important program, but it's going to take practice over the next few years. So just make sure you kind of bake that into your strategic plans for the next few years. The other thing to go over is antibiotic stewardship. This is also going to be due on November 28th. This is a huge push by CDC because the rates of C. diff they're seeing rise across the country, and I'm sure you have all dealt with C. diff residents. It's not a pleasant experience for them and for anybody. It's a really debilitating experience and often leads to death in the end, and it disproportionately affects the elderly. And the big driver behind C. diff is inappropriate use of antibiotics. So it's really a big program to track how many antibiotics are being given out, what kind of effect it has on the residents, and really it's going to be ultimately up to the medical directors to make these prescribing decisions. So as leaders of DONs, administrators, MDS, anybody, you really got to get your medical directors on board to help them understand how to make these decisions better, because oftentimes I don't think physicians really know how antibiotic prescriptions might affect their residents. So it's going to take that strategic approach to get them on board with this, and that can be very difficult sometimes when you're talking with physicians. And the last thing, I'll send this link out as well. CMS has released something called survey pathways. And so these regulations are huge. There are so many different sections to these regulations, and I know it can be extremely overwhelming. But they actually print it, and you can find this on the CMS website, and this is the link I'll send Debbie. But they have a checklist for every single regulation that they're going to be looking at after November 28th. So, for instance, like the QAPI, they have a specific checklist of the things they're going to come in and look at and check off as they survey you after November 28th. Same thing for your infection control program, antibiotic stewardship. It literally is a roadmap for what they're going to take a look at. And I think it helps in two different ways. One, it can help you prepare for survey after November 28th. This is new for everybody, so they're going to be learning, you're going to be learning, and it's just kind of a bridge that lets you know what they're going to be taking a look at. And I think it also can provide some insight into the plan development that you're going to have with QAPI, stewardship, infection control, because you want to make sure your plans hit on these elements that are in the checklist, because those are the questions they're going to ask you. So it's a good kind of roadmap to take a look at. It can be pretty daunting because there's so many. But I think over the next month and a half, just get your teams together, divvy up the work. There's a lot of stuff to do, and hopefully these templates can kind of kickstart that for you and help you out. So I'm going to send all this information over to Debbie to distribute after the meeting. But I also have my cards that can pass this around. So if you do have any questions, I'm happy to field those today, or if you want to shoot me an email or give me a call, I'm happy to help out with that as well. Any questions? Correct. Surveyors will, so after November 28th, they will be able to ask for that, and they will most likely ask for that. I don't know how in-depth the first year, because I know in Arizona, they're going to be a little bit more lax on the first-year surveys, but it's certainly open for survey. But, think about the assessment, too. I mean, that's where you define your staffing ratios, number of residents that you care for. I talked to one facility who's going to break down their anticipated burden by quarter, because they know it fluctuates seasonally, so they want to be able to prepare for that. And it's one of those things that they want you to go back at least once a year to update it, but I think it should be updated the minute you have a change in something. So, for instance, if you do a QAPI project and you find your staffing ratios are not adequate over the weekend and more falls are happening over the weekend, you decide to bump up your staff, that should be reflected back in the facility assessment. So whatever you find should always be matched back to that, because that's kind of like your master plan for the facility. So I'll send all these links over to you, Debbie, so you can send them out to everybody afterwards. So
I think we'll have to find also during our grant.
Yeah. Yeah.
I don't want to get late. We told you we were running a little bit too long. So again, I just want to remind everyone that we have connections with CMS on the rate. Indian Health Service, Dr. King, and then Administration of Living. They're all very supportive. Cynthia and Tonton on that tribal technical life. And Cynthia actually assigned staff representatives. She has not yet called in, but it's assigned. Okay, Tony, I think we're ready for Tony, we're ready for the KAI update.
Thank you, Debbie. We're going to let Jonathan start, and then I can go. Is that okay, Jonathan?
Yes, that's perfect. Good afternoon, everybody. Again, I'm Jonathan Collins from Kaufman and Associates. I just wanted to give our update as far as the U.N.I.T.E group is concerned. For KAI is responsible for assisting to develop best practices reports for the Nursing Home Collaborative on behalf of CMS. So for the next round of best practice reports we are going to do, it's going to be focused on emergency preparedness. CMS felt like this would be a good topic to cover based off of all the recent events that have been occurring around the country. And we want to focus specifically on emergency preparedness for nursing homes as a resource that you all can use and that can be posted and spread out on the CMS website. And that will be due to CMS in December. And then we have another round of best practices reports that will be due in March. And for that best practices report, we are going to focus specifically on a summarization of what the collaborative has done over the past year. So that will cover the dementia assessment tools, best practices that we did in the summer, and the 2 webinars that the panel discussion in the spring, and then the report that we did on dementia and the report on communicating with the governing boards. So that is the direction we're looking to go for the next 2 reports. Also, we talked with CMS, and we're looking to use other resources outside of just reports to kind of deliver the information for you all. We talked with CMS, and CMS thought it would be a good idea to look at possibly revisiting traditional foods, but making it more interactive, and possibly visiting one of your nursing home facilities and having a traditional foods demonstration done, and then we record it and record the visitation of the facility and use that as a tool for the TA Center and to be posted on the U.N.I.T.E page.
Okay, and just remember, everyone, that we spent all last year talking about traditional foods and had lots of good resources and did several webinars, SOGA, NICOA, SOGA, NCAI. In fact, we're going to give you the super out the first Sunday, which I posted, and we actually presented it at NCAI for their mid-year conference. So definitely something that we've committed to, and so I think that's a great idea, Jonathan. I haven't actually heard that.
Okay, thank you. I'll take it a little bit from here. Oh, sorry, Jonathan. Go ahead.
Oh, no, I just wanted to remind everybody that they can find all of the best practices reports and the webinars on the TA Center under the U.N.I.T.E Group's page.
And I'm going to show them that when you guys are done. I'm going to actually log on and show them the actual website.
Okay. All right, Tony, I'll hand it over to you.
Thank you, Jonathan. Okay, so a couple of different things that have been covered and what we're going to be doing for communication and outreach. Debbie and I are going to work on the membership and improving that list of the tribal nursing homes, both on CMS and outreach to them, inviting them to participate in the monthly call for U.N.I.T.E. In addition, we're going to continue to do the reminders for the steering committee and the monthly call. We're going to make the handouts available via the 2 different systems, both through Gmail and through the email outreach. It sounds like there's going to be a thank you email or a resources from the actual annual meeting that we'll compile and send out after the actual annual meeting completes and concludes. And then the other follow-up was, I mentioned a little bit earlier, but there was a wonderful LTSS webinar covered last month in regards to funding for both Title VI and different things that could be funded for the nursing homes. So we're going to be sending out that thank you email with a link to the recording specifically to the U.N.I.T.E members, just so they have access to those resources kind of summarized, in addition to the cheat sheet that was included in your packet and Debbie had talked about earlier. So that's kind of what we got going on for communications. At any time, if you think someone's interested, we do have a sign-up sheet now, and so I'll start providing that at the bottom of the communications, and that way you can recommend others that might want to join in, and it pertains to.
So there is a fair amount of changes going on with how we're communicating other things to MS and an initial survey with our staff. If you notice on that last LTSS newsletter that you got, there was a little blurb about what a tribal nursing home for year for staff. That was based on some information that I gave to KAI, where I surveyed our own staff and just some things I do. But also, I had asked for feedback from the collaborative. I did get some. I think, Sheila, you sent some. And then I got some from the One Assisted Living facilities up in Alaska. So I kind of put all that together and did a little telephone interview with KAI and asked for that. But ideally, we want to all be part of that, right? So we're getting the best information from all of us. What works, what doesn't. All right, so thank you very much. Does anyone have any questions about KAI and their role? All right, so thank you very much, Tony, and thank you, Jonathan. I'll follow up with anyone if they have questions on that. So if we can shut those curtains and dim the lights, I'm going to log on real quick and show you the web. We're working, getting through this. I'm going to give Ron his 15 minutes. So we should be done about... Yeah, we'll probably want to eat lunch till about 12:30. I hope that's okay with everyone. If you want to go out right now and grab some quick to see this is still out here. Okay, if anyone needs a refill on coffee or something, go ahead and get that now. Probably about 12:30 before we break. Jory, can you start on? Yeah, go ahead. Oh, that's that. I'm sorry. It's over there. I'm doing it. After 6 years, I still did that, but I don't think so. All right, turn my little light up. Oh, I have to connect. I know it. All right. I'll have Apple TVs. That's what we use. Hey, let there be light, right? Okay, so when you go to cms.gov, right, this is what you do. So if you haven't done this yet, go to Outreach and Education, so right over here in the corner, click on that, and then you see this whole list, right? You're going to go right here to American Indian / Alaska Native, click on that, and that's when you start seeing some things for real. Okay. You have tribal consultation. Here's the group that I told you about that I use with them once a month. Tribal Technical Advisory Group, Affordable Care Act, All Tribes Calls, the CHIP program, long-term services and support. There's your technical assistance. We're going to look at that real quick because KAI is doing some updates on this, and they would like our feedback as collaborative. If you guys see anything here that needs changing, can we, anyone make right? Outreach and education resources, state tribal relations on healthcare, trainings, and how to order tribal products. So you got lots of things. We're going to go into the long-term services and support technical assistance center. That's where we're housed. Okay, that's where we're housed. So if you look at this, you've got their webinars. Okay, so there's a webinar archive. So all those webinars that we're talking about, the one that was just on this number that I used PowerPoint for. This is where they're all archived. You can go back at any time and listen to any of them. You can sign up for their newsletter, which I strongly suggest because it's got great information. Okay, and then here's some other resources. So, for example, when Dr. Jordan Lewis, he had to go speak at a conference, he actually called me and said, I need some information on urban tribal programs. Where do I get that information? I told him. And he was able to go here and explain the whole way to get the data for the presentation. So for tribal leaders, so again, I think our own Francis Stout here is on one of the YouTube videos here. Watched her before. So financing, financial planning and budgeting steps, funding sources and how they work. Here's some of their focus areas. So this is where we are. We're under their focus areas. Tribal hospitals and palliative care, Native veterans, caregiver support in Indian countries. So Elizabeth, abuse prevention, emerging issues, and then where we are. Okay, state and federal relationships, math, planning and evaluation. Okay, program evaluation. So if we do work on a grant, we might want to come back and look at this. And then, of course, your program structure. So here's what Leah Linsky was talking about last night, and then he followed. So that's where that is. Okay? And then, of course, there's some other resources here, database. This is a great database, by the way, for doing like research. And then examples of videos of programs. I think Francis does one of the videos. Right, so I want to go back and just show you the U.N.I.T.E. So if you go on here, you see our logo, and it says what we're about. And then you can see here our conference call. So here's all the recordings. So this call today is being recorded in the here. So you've got everything. I think we're up through July. So we still need to put on this. You can visit our website. Some people have contacted us by this website. Overview of tribal nursing homes. So this is the report CMS produced. Jonathan, do you know how old this report is? The PDF on here, 14 pages.
I'm not sure. Let me bring it up.
It's under
Julie, do you know?
Overview of tribal nursing homes. I was just curious how old that was. The directory, I believe this is the one I printed out. And then here's our best practice report. You can see what we've done. All right, so we've got one on traditional foods, dementia and Alzheimer's disease, communicating with governing boards, and assessment. We've done all those. Here's our webinars, the ones that we actually, like in your blue folder, the one I printed out for you, the slide. That was the one that Tammy and Francis did. That was this one. No, that's not on. Actually, Jonathan, that one, the LPSS webinar, that one's not on here yet. The one that we did in July.
Okay. I'll make sure that we get that one added. I'm not sure why it's not up there yet.
Yeah, we need to get those on here. So we've got the two we did in 2015, the two we did in 2016, and now we've done two in 2017. Okay? So those still need to get put on. All right. So,
and Debbie, that report is from 2016.
Oh, is it? Okay. So you all might want to take a look at the nursing homes and Indian country report. That's from 2016. Right. So then you click on here. You're going to visit the U.N.I.T.E. website now. And this is what, when you guys met William Oliveris that came in here, our IT manager, he put this together for us. Okay, about 2 years ago, I think, or a year and a half. So U.N.I.T.E. Group, Uniting Nursing Homes and Tribal Excellence. Welcome to our page. So if you look at, he has like every time I post something, the team reach to that email, it links right here. So see where it says by me. So every time I send stuff out to that TREA email, that was our first name before we came up with U.N.I.T.E. We didn't want to change the email because we were afraid we could get it messed up. These are links to this website. So everything I send out goes right here. So you see all the stuff that's been sent out. Okay? I tend to send a lot of things. Sorry about that. All right. I like emailing this one. All right. I know. I keep sending out so many emails. Okay, so we have a group calendar, which I'll be honest, I haven't updated it too much. But there are some slides here. This was our PowerPoint we did for our traditional food presentation last September at NICOA. So our occupational therapist, sweetheart, even though she doesn't really participate in U.N.I.T.E., said she would go and do the presentation at NICOA. And at Niagara Falls last September and went and did this presentation. And so you can see here, she took some pictures of our tribal elders gardening and she was able to take some of those. If I could bump it up a little. More. I'm not sure if it's going to let me in one spot. But you can see there we've got traditional food, our recommendations, the future of U.N.I.T.E., and all the pictures. Some of those we just came in. I just came out here. It was in April and the flowers were starting to bloom. That was us. See, September 12th to 14th. Andrea Barnes. Alrighty. Got that. And then U.N.I.T.E. group calendar. So again, we'll get to it. Okay. our U.N.I.T.E. Now we're back to here. And the last thing I want to show you, I'm going to get out of here and I'm going to show you U.of.A. where those elder care providers. So it's, hold on, I got to turn the light up. I have lights. Aging. Okay, so you can go to aging.arizona.edu. All right, so if you type in aging.arizona.edu, you're going to get to here. Okay, so this is the website for the Arizona Center on Aging, which is who sponsored our dinner. And if you go to education and training, scroll down, you're going to see the Arizona QEP and Reynolds sponsored project and program. So here's your elder care sheet. I wonder if there are any ways. So let's just look at these. So go to your elder care sheet. There's a resource for interprofessional provider. And Laura Vidkis is still there. I just saw her. Here's your current list, and you've got a lot of stuff here on Alzheimer's related disorders. Got all these links on geriatric systems. I mean, anyone that's doing training, okay, look at that. You've got a ton of good information. Sensory mobility, consideration of care, all of this stuff has been done over the years. I authored one on spiritual care. Sometimes Professor Lewis just authored one on cultural considerations. Current topic list was here, so you can see all the different geriatric syndromes and all the different topics that they have. So this is really an excellent resource. If you have not looked at this yet, this alone is now for an entire year. Okay, so I would print some of these out and find them. I mean, seriously, I'm going to ask the same questions. Have it read by tomorrow, whatever. These are simple and easy to read. Anyone have any questions? All right, excellent. I'm going to turn the lights back on. And we'll finish up our meeting. Ron, I'm going to let you have the floor here for like 2 minutes. Okay, we don't need any calls here today. Hold on to that. We're going to have to serve him one.
If you go back to that CMS website.
Oh, you want? Okay. Hold on. Just afraid I get this.
I'll back down.
CMS.gov.
Back out to Ellie, and then go to American Indian, and then go over here. Okay, come back down. Right. Go to the finance, planning, and budgeting stuff. All right, then come down a little bit. Yeah, we'll find it. That's where you want to go.
Okay.
So, when we got involved with the folks from Pioneer Executive LLC, they were interested in building a nursing home, and they visited with us. We manage nursing homes. We have 20 other nursing homes that we manage, all in small towns. Most of them are in Nebraska. And we had done some work up in that area of the state, and so we knew some of those folks. And they wanted the nursing home for the last 30 years. They had an advisory committee for 100 years, and they get to a point, and then they get to a point, and then they get to a point. And so we started visiting with them, and I can tell you it took 9 years. It took 9 years from the day I walked in the first time until we could admit our first resident. And there was steps to this, but I can tell you that probably one of the biggest steps is how you're going to pay for it. And we were fortunate enough that a wealthy tribe in Minnesota, the Shakopee, said that they would loan them the money to build the nursing home. Let me repeat that. They would loan them the money to build the nursing home, but they expected to get paid back, and they expected a reasonable interest rate on their money. And so there was a financing source, but you had to see how to make that work. CMS does a great job on their website to talk about how there's the opportunity for a tribe to work with the state that they're in, and for that state then to work with CMS. And that is truly the key. It is up to the state to do a state plan amendment on their Medicaid program that is going to get a rate high enough for you to, in our case, not only pay the operating costs, labor, supplies, and all that, but also to make sure that we could make a principal and an interest payment on that loan. And that was the key. Every state can negotiate with CMS on how they want to give an enhanced rate for tribal members that are on Medicaid. So it is very state-specific. And I can tell you that my journey with Nebraska to get this accomplished wasn't too bad. I should give you a disqualifier here. I was the Director of Health and Human Services for Nebraska for 5 years. And so I might have had some working knowledge that other people didn't have about how to navigate and work with the state Medicaid program and all of that, plus the legislature. I had a good relationship with the legislature, and so we had a moratorium on nursing home beds, just like a lot of states did. And so that was the first hoop to jump over, was to make sure that we could build the nursing home. Pine Ridge is a huge landmass. There's about 35,000 members of the Oglala tribe that live on the reservation, and then they probably have another 10 or 15,000 members that live off reservation. And they didn't have a nursing home. And they wanted a nursing home for their people. And so South Dakota had a moratorium on nursing home beds, too. And the Oglala tribe was unsuccessful in getting the South Dakota legislature at that time to modify their moratorium situation for nursing home beds. But in Nebraska, and the Oglala folks own about a quarter of a section of land that pops down into Nebraska. Now, the entire reservation's in South Dakota, except for this little piece, about 160 acres, that pops down into Nebraska. And that's trust land. And so they approached us and said, well, what do you think about that? And I said, well, Nebraska's got the same thing as far as a moratorium on nursing home beds, but let's figure out why the legislature might be willing to exempt tribes from the moratorium. It gets back to the CMS website. And it basically says that if a state is willing to adapt and amend a state plan, and that tribe is willing to work with Indian Health Service as part of a 638 document, if they're willing to do that, then the federal government will reimburse 100% of the cost, and so the state does not have to put its share into the general funds into this rate. Well, if a state doesn't have to put their money into the enhanced rate, they get pretty easy to work with compared to how they were before this situation took place. So we dotted those I's, crossed the T's, made sure everybody was on board. We had a big meeting with quite a few of the tribal folks. They had to come down to Lincoln. It wasn't just a couple of councilmen, it was a bunch. And we had a meeting with a governor and his Medicaid people and all of that. It wasn't the same governor that I had worked for, but nonetheless, it was a governor. And so his question to the Medicaid director was, so the feds are paying 100% of this? Yeah. Nebraska doesn't have to put any money into this? No. You got that in writing from the feds? Yes. Fine. Walks out. And I said to the tribe, there we go. We have an opportunity now to move forward. So then there's a whole lot of work to be done. You all know that. I mean, if you have an existing nursing home, you've already gotten do a lot of work. But if you don't have a nursing home, you've got to start from scratch. That's a whole lot of work, too. So anyhow, we communicated with the Shakopee, the wealthy tribe in Minnesota, and they were willing to say, okay, explain to us how this works, because we've got to make sure that we're going to get our payment. We're going to lend you the money, but we've got to make sure that you all know what you're doing. And because in our case, they loaned us $13.5 million. No little change, and so you've got to make sure how you're going to pay that back. So we worked with the state of Nebraska and their state plan amendment with the feds so that they could see the regulations of how you're going to get paid and all that. Nebraska decided to do a cost-based reimbursement, which basically means as long as your expenses are reasonable and allowable, similar terminology as the Medicare program, only we're just talking Medicaid now, it's going to be reimbursed. Wyoming, I was visiting with Tammy yesterday. I think her rate is $328 a day. And prior to getting your enhanced rate, it was probably somewhere around 160, 70, 80 bucks a day. And that's pretty typical. I was talking with Sheila here, and I think they're getting about 180 bucks a day. Well, you can't run a very good nursing home at 180 bucks unless somebody's going to subsidize. And so when I talked to the Oklahoma folks from the beginning, I said, I'm just not in a position to help you unless we can get a higher rate, because I just don't think I can do a very good job. So after we got the enhanced rate and everything, and there are caps, for nursing costs, there are caps for fixed costs, there are caps for support costs in the Medicaid program in Nebraska, and the way the state plan amendment was written with the feds was we can go over those caps. And it will get reimbursed by CMS at 100%. Right now, Montana, last I heard, and they're working with the Crow and with the Blackfeet, and hopefully those folks can join the consortium down the road. They were getting paid $394 a day the last I heard. And so that's a world of difference from 180 bucks. Now, I know both of those facilities up there because I visited those folks, and they're old and behind the times, and they'd like to build new facilities for their people. And at a rate of $394 a day, you can kind of make that work. You can't make it work at 180 bucks. You have a hard time just paying the labor and utilities and stuff at 180 bucks. So I guess I'll just close and also say, one of the exciting things that we found working with the Oklahoma folks was by having an enhanced rate, we were able to pay our employees better. And I'm sure you guys can too. We start ours off at $15 an hour for nurse aides. We have a health insurance program. We have a retirement program. Now, these are all things like federal government employees have gotten for years, and why can't our employees get something similar? So these are all allowable, and they're all reasonable, and so the program works well for our employees. I would say 90-some% of our employees are tribal members. And then the Rosebud tribe, we just got involved with those folks about a year ago, and they have an old nursing home. And so we started our journey with the South Dakota Medicaid folks about a year ago, and we are about crossed the finish line. It has been a journey, but they have been supportive. It took a while to get them on board, and it took a while to make sure that our priority was the priority of theirs. And so their state plan amendment now is going through the channels. It should get to CMS home office real soon. Our reimbursement rate will go back to July 1 of this year because the state plan amendment was submitted during that quarter, and they'll go back to that quarter. So we have probably lost during that quarter, July, August, September, probably somewhere in the neighborhood of excess of 100,000. We are anticipating CMS through the state to make us whole to those costs, which in turn, the Rosebud tribe is poor, and their tribe cannot afford to subsidize the nursing home. In 2013, I think the tribe subsidized $1 million, and I believe in 2014 they subsidized it somewhere around $1 million. And in 2015, the Shakopee tribe actually granted them, not loaned them, granted them $750,000 to help them keep the doors open. And I suppose because of our working with the Shakopee and they knowing us, they asked us if we'd come up and help them. Our thoughts was just to do some consulting work, but then it turned into management. So I would just tell you, close and say that it is up to the state, educate the state, whether it's Arizona, whether it's New Mexico. This is a no-brainer. CMS is sitting there saying, hey, jump through these hoops, do these things, become an IHS 638 facility, and we'll pay 100%. So if you have people in your nursing homes in Arizona, New Mexico, wherever, and the state is putting their portion of Medicaid into that, all they have to do is juggle a few things, do a state plan amendment with the feds, and the feds will pay it. Hello? This is really not rocket science. It is not an easy thing to get done. I'm not going to say that. It took us a year up in South Dakota. I think that if y'all are interested in something like that. Now, the other side of that is that's not an end all because if you have private pay folks in there, they're going to have to pay their share of the cost too, and things like that. So all this does is get the Medicaid program to pay its share of the cost, which in my 30-some years of being in this business has never been heard of before. I take any questions you guys have. Get out of your way so you can eat. Well, we'll go back.
Go back?
Yeah. Let's go back up here to LPS financing. All right. Come on down. Go back. Right up there. 100% FMAP. Educate your state. That's what I've been talking about for the last 15 minutes. There it is on the CMS website. I didn't make it up.
100%. There it is. We're under LPSS financing. And then here's the next one is 100% FMAP for LPSS. Okay?
Yeah, you got to educate your state.
That's what he's talking about right there. The win for tribes and states. How to become eligible, right?
Kind of walked it through. They've done a nice job. CMS has done a great job of trying to educate tribes on how to work with their state so that the state will amend their state plan so that they can pay them a higher rate.
Anyone else have a question in terms of
Oh, sure, yeah. All right, go to www. So it is kind of good looking. OSL, when you type it to the dot in, www. It is dot OSL.NH.com. Oklahoma City, Minnesota. Okay.
That's it.
That's it. Pretty simple.
Just see pictures of what he's got.
Can you say that URL one more time into the phone a little bit better so I could follow along too, please?
You betcha. It's www.OSLNH.com. Short for Oklahoma Sioux Lakota Nursing Home. And it's, I don't know how many pictures you have there. There might be some more down here. Yeah, that's the ceremonial room looking out. A picture of the outside.
And how many beds is it?
It's 60 beds.
We're looking at the pictures on the website right now of the brand new tribal nursing.
Is there any down here, Debbie? Come over there.
That's just the UNH. Go to gallery, like that have it.
That's probably some of the older ones. But yeah, it's 51,000 square feet. So it's nice size. Rooms are such that there are 25 semi-private rooms, but these semi-private rooms are designed so that you don't see, the residents don't see each other, and each one has their own window to the outside, and there's kind of a wall in between them. They have their own TV. They share a bathroom, but they have their own space. There's a nice physical therapy area for residents, activities for everyone. It's just very well laid out.
And this is actually in Nebraska, and that's
yeah, in that quarter section.
is it full?
No, we got certified last November, so we haven't even been open a year. And I would just say, if you're going to build one, make sure you understand the difference between getting a license and getting certified. We got licensed in August. The state was down 7 surveyors. Head surveyor had cancer. It was a goat road. We finally got certified in November. And the cost between license and certification, if you're all Medicaid, you don't get that. You don't get a dime out of Medicaid until you're certified. So even though we got licensed, and I'll tell you, I only let 6 people in the building. All the residents we took care of during that period of time. But we knew we were going to have to keep the cost. But we have 30 folks in there now, and I'm sure that as we get into the winter, we'll get 2 or 3 more. Pretty soon we'll be. All long term. Yes, it's a nursing facility. It is not a skilled facility. Now, one of the things I would caution you on Medicare and skilled is you're getting a flat rate from Medicare. Plus you have to provide the medications. Plus you have to provide the therapy. So if you're getting $400 a day for a Medicare person, and you've got to supply the drugs and you've got to supply the therapy out of that $400, and it costs you $400 a day, just the room and board, you're going to lose money on every Medicare person you have in there. And so that facility is not a skilled facility. We purposely made sure it was not a skilled
He said 30.
Right. Oh, yeah. When they did their feasibility, before we got involved with them, they identified about 200 of their tribal members. You have to remember, there's 35,000 people in the reservation. And they were living in other nursing. Another thing that, a couple other things you might want to probably deal with this. You already have it. Several of our residents come to us by being court appointed. They're just not being taken care of in their homes, so the court has to get involved. And these are trying to get involved in that way. It's a better place for you to live.
You allow them in get an X-ray. They're there for 2 days.
I can tell you that the board, and we deal with the board, there's 3 people who are advocates for the nursing home, 20 totally involved with it. But a lot of people like you, Francis, who are advocating for their nursing home. There's a policy. Unless you're on Medicaid or you have the resources, you're not in. Because, if it's going to cost $400 or $500 a day to live in the nursing home. That's $12,000, $15,000 a month. 1 month goes by. The tribe is not putting one dime in. Nor will they. Nor can they.
It will help people fill out the Medicaid packet and do whatever they need to do to help them. We help families all the time, but we do not have anyone if you do not upstairs. If our tribe can't subsidize either.
Exactly. And the overall folks are in the
If you get help from the tribe to have.
We don't. Now, the Rosebud folks, hopefully they'll get to the point once South Dakota gets their state plan, their subsidy will go down compared to what they had. Well, there's an U.N.I.T.E hospital there at Pine Ridge, and they can participate in the swing bed program there. We have to do is read the papers and stuff. The U.N.I.T.E hospital at Pine Ridge, the ISS hospital at Rosebud, the U.N.I.T.E hospital. They don't. Probably aren't the 3 best U.N.I.T.E hospitals in the United States. So, challenging. Yeah, and they get it back. I don't stay up on that. I just know that I'm visiting with the folks I visit that they're not real anxious. And that's another reason to go there. That's another reason why we kicked in build-in health insurance for our employees at nursing homes so that our employees would have options going someplace other. They appreciate that.
Okay, we take Medicaid people or Medicare people, and we do, as much as we can, as fast as we can, and get them signed up for Medicaid so that they can be discharged from there and then fall back under our Medicaid rate, which is way better for us than going through all the hits for the headache. And I would say 97% we don't qualify for Medicaid, which is no one has a thought.
So it sounds like those involved in state and
It is. All state and then all.
Okay. Right, so I need to watch our time to discuss this as well. honestly, last night we did a little game for those of you who were there. What history is, what we call sports and financing. This kind of stuff was obviously the number one. So, you know, there's other things too, obviously, like keep there, just deadlines with and stuff like that. But stuff. So I'm going to turn the lights back on, and we just got disconnected already. I think I'm going to, if you look at your agenda, there was I had kind of some open discussion, but since we're running late, I'm going to skip through that. We talked about the brochure, got the update on native food. I handed out the Title VI handout to you. And I would appreciate this. If you all could go back today or tomorrow, and later, go back through DMS.gov, Education Outreach, go through the Bible Technical System Center that you looked at. And I would like you to kind of look at it and say, what else could be here? What's not? You know, what could be different about it? And send me those your recommendations. I promised the AI that we would have tonight collaborative, but then give them feedback. There is little of updating that section, that website. Okay? So see anything there, like, oh, I think I need more pictures, or I'd like to find that at least by next Monday and send it out. Okay, that would be really helpful. Or if you have any recommendations to our website. So thank you, Ron. The last thing we need to do, I've asked you on your evaluation, please identify if you've been able to be on the hearing. And on that evaluation path. If you don't find me, just leave it here on the table and I'll get it. Okay? Does anyone want to make a change in the date or the time of our monthly call? So right now it's the third Thursday. It's going to stay at 3 p.m. Whatever that looks like for you, where you are. Are we all okay with that? Anybody want to change that? All right, then the other thing is the location and date of our 2018. We've been bringing that up now, but I think we could have gotten there. We kind of made a late decision. Most people plan for 2 months. So, you know, I think this is important to discuss. I'd like to suggest, Justin, steering committee has talked about this, we've talked about the summer calls, is that we meet as part of the 22nd NITOA Conference on Aging in Country, which is September 10th through the 13th of the year, in Temecula, California. Resort and casino. So how does everyone, I mean, we talked about this before, we have a good working relationship. We have a good working relationship with NITOA, Mandela Blue House, and the staff, so it may be a fit. Does anyone have any thoughts or have any other suggestions?
Excuse me. Hello, Debbie. Hello, everyone. This is Joseph Ray calling from Santa Fe.
Hi, Joseph.
I apologize for not being at our annual meeting, but I want to compliment everyone for being there. That is there, and I just look forward to the future of our U.N.I.T.E group, our U.N.I.T.E collaborative, and I'm here at a Medicaid meeting for New Mexico. It was called the State Tribal Consultation for the Centennial Care, the Medicaid managed care program here in New Mexico. And so I apologize for not being at our meeting in Tucson, but again, I think everyone hopefully understands the importance of me participating here in Santa Fe. Also, there was only a few tribes represented today by tribal leaders, and there was only a handful of other spokespersons for tribes. So it was again to me a disappointing turnout. But then again, as I offered previously in some of our planning meetings for today's meeting. Outreach to tribal leaders is, again, key, as Mr. Ross knows, and so I want to thank everyone for participating today. I look forward to, again, working together in the future, and so that's really all I have to say, other than eat good.
Thanks, Joseph. Are you okay with us meeting next year at NICOA, September 10th through 13th?
That's another key component of our work. Also, I want to offer again my position with the National Congress of American Indians. That there's that platform for us to advance our mission with the U.N.I.T.E collaborative. There, we have the Disabilities and Elder Subcommittee again, where we can I think we need to maintain a presence at that level too, and just to share, I was in Milwaukee earlier this week for the annual conference where I was wearing one of the U.N.I.T.E hats and promoting us to tribal leaders that I met there. So again, NCAI in my capacity is there as a resource. Thank you.
You know when their annual meeting is for next year? Next
year, yes. And in fact, the annual meetings are going to be in the West, and then coming up to Alaska in 20. Next year, the annual meeting will be in Denver. There's going to be a mid-year conference in Kansas City, then Denver, then Reno, and then the annual in 19 is going to be in Albuquerque.
Okay. So Denver, do you know the dates on that for next year?
Not exactly. All I know is that it's not on Parahi Feast Day, and if my mother, Josie Lucero, is in attendance today, I had to miss Parahi Feast for a few years now, so I really need a hug.
What's that day you get what is that?
It's lately been October 17th these past years, but I know next year it's going to be like a week later. So in the October 20th time frame next year. But I'll get those dates out to everyone. No worry.
Okay, so that's another possibility. I mean, we don't have to make a definite decision. Would anyone here feel more strongly about maybe our annual meeting of President I versus NICOA? I think I may be wrong, or Francis, but isn't NCAI more like political?
I would say.
Okay. Right? Like, NICOA is more like,
yeah.
I would go more. So maybe we should look at national conference. Yeah, every so right, so I will address those two with the steering committee, and then we'll make a decision on like our January call.
Either that one or the leading age, nonprofit, I'm active in our state, even in nonprofit.
I think our board members are fine. That's certainly something we can discuss. I would say I put that on the agenda. Give you a decision. I think if they had it in administrators could get CEUs, yeah, because they'll need them, and if someone might be willing to be carrying out their organization anyway.
And I think U.N.I.T.E would probably figure out how to help the consortium.
Kind of like almost an interest.
Another thing I think we ought to give some consideration to is that, the SHAC is get $20 million in grants. And the consortium here is probably the first story.
So our next regular meeting, so thanks, Ron. That's going to be listening to what has been a lot of our work on the grant that we tried at last. Well, we applied, I think it was January 5th of this year. Worked on it November, December. But Rebecca has updates for us. So we're pretty much done with our